Hey there, I'm Dr. Josh Jagoda. Today I'm going to show you a little bit about how to treat your arm pain as well as your finger pain. Now, a lot of times people in jiu-jitsu, baseball, a lot of activities that use your hands, you get a lot of finger pain. And I've showed it in the past using the Graston tool, but not everybody has the Graston tools. But a lot of people out there have access to these broad tools. Now, this is the Graston tool, but these broad tools come from different makes and manufacturers, I should say. So as a result, a lot of people have this type of tool. So what we're going to do is I'm going to show you a quick little demo on how to do it so you guys can get right into the nitty gritty. So first, I want to recommend that harder is not always better. A lot of times we think we need to go at hard, but we also need to realize that these tissues need time to heal, and if you constantly hurt them and you go harder, you're not giving them the chance to healing. So it's about doing the right amount of damage, so to speak, but at the same time being therapeutic with that. Okay, so the first thing you want to do is you got to remember that the tendons run all the way down and through here. So you can use oil, you can use emollient, you can use lotion, doesn't really matter, but I would recommend you using that. So what you can do is start even just gently and lightly. You could go a little bit harder through here, just be careful, there is a nerve here, so you want to go and work, going down. You also want to be able to switch the tool, guys. You always definitely want to switch the tool onto both sections. So make sure you switch it from up to down, down to up. You want to make sure that this beveled side right here, just like this, is on the skin and at about 45-degree angle. So you're going to go like that. Eventually you're going to get into the finger, right? So first I want you to go very gently, almost like the weight of the tool, just to get some what we call fascial manipulation to that. You can go onto the sides a little bit, especially in like this middle knuckle finger. You may find that. So what you want to do is eventually you'll go like this to the middle finger, going side to side. And I know that I've had many middle finger injuries just like this. I'm trying to show you guys, hopefully it doesn't blur out. And then what you're gonna do is eventually you're gonna go right around the knuckle. You're gonna go just above the knuckle. You're gonna go just at the knuckle. You're gonna go just below if you can. You kind of almost like a ice cream scoop, kind of just like this. But you're gonna go very light. Remember, guys, what you want to do is not just go up and down. You want to kind of stroke the ligaments just gently like this. And you want to also potentially bend the finger a little bit. You want to extend the finger a little bit. You want to treat it in different areas and as well as different positions. In addition to that, what we want to do is change the angle, as I said before. So we went down, now we also want to go up. We also want to go up on a diagonal. We want to treat all different areas and different structures because the injury and scar tissue and discomfort is multi-directional. So we want to make sure that it's not just going this way, it's going this way, it's going this way, it's up, down, left, right, in and out. And then we want to always treat above the site of injury as well as below, and you're going to notice that just doing this a couple times a week will make it feel much better. And then just starting that, getting some mobility back is a great option. Finally, what we're going to do is I'm going to show you active release technique and some mobilization. The first thing I want you to do is grab the thumb or the finger that's injured. So imagine if it's this finger, I'm going to grab it under, I'm going to grab it over, and I'm just going to pull, and then I'm going to extend it a little bit. So I'm going to kind of pull and go like this. And what that's doing is it's essentially taking the two capsules here and it's pulling it and gapping it. Ligaments that get injured, especially in the fingers, they're very tight, they're very fibrous, they're very, very dense. Because they're very dense, you need a little bit more of that long-term release. It's not like a muscle where it'll just give in like 10 to 15 seconds or a couple of breaths. It may take 15 to 30 seconds or even a minute or two. So you may have to hold it in this position and you may get a couple pops or clicks, but you're just going to hold it. And if your hand starts to slide, you can use a little tape, you can use pine tar, you can use anything. If not, if you don't have anything, your hands are a little slimy, that's okay. Just go back and over and just do a little bit more sets. So you can see I'm starting to slide a little bit. That's okay. Just come back and try to hold it. Maybe you can wiggle a little bit, try to give it some range of motion, and that's how you're going to mobilize the fingers, the knuckles, and get that treatment. I would recommend that anybody who's having a significant restriction in mobility or strength within the fingers, that you give it at least 3 times a week for at least 2 weeks, before you start to actually see some results, but you may start feeling it. And if it's just for pain control, that's okay at first. So give this a try, guys, whether it's with your hand, whether it's with a spoon, whether it's with a Graston tool or some sort of other manufacturer. It will just help you in the long run. So thanks for stopping by. I'll see you guys next time.